Hi, this is a nursing professor. I want to talk to you today about the difference between palliative care and hospice care because they both provide a patient and a family to make appropriate choices when many times the end of life is a topic of conversation. So when we talk about palliative care, we are talking about a time when a cure is no longer possible. And so that can either be that the patient, him or herself, has decided enough is enough. I don't want any more needles or, chemotherapy, or sometimes some of the harsh treatments that we do use in order to extend life. And so just understand that that is a patient choice that they can make. And so when we talk about palliative care, we are vested to provide as much comfort to a patient as possible. And so it can almost be thought of as aggressively planned comfort care because it will take different types of medications and therapeutic interventions in order to maintain the comfort of that person. It includes addressing end-of-life concerns like advance directives, like a living will. What do you want to have happen? Who do you want to make these decisions? Frequently the question is, can I change my mind? Absolutely, you can change your mind at any time with both palliative and hospice care. So it does continue to give the patient freedom of choice. Support is provided to both the family, any caregivers involved, and the patient, of course, him or herself. And it ensures that that person is given the information necessary to make an informed decision. The treatments that are provided are designed to minimize unpleasant symptoms that sometimes people experience, like a person who's in chronic pain. They just never feel well. That can't possibly feel really good. And again, patient's choice, no judgment. Or a person who's always nauseous. If you've ever been nauseous, then you know that's a very uncomfortable symptom to experience. So let me be clear, palliative care does not mean no care. It does not mean that this person is actively dying. It just means that this person has elected another way of dealing with the symptoms and the disease process that he or she is experiencing. So there's no time limit. So there's no one that came about and says you only have 6 months to live or anything like that. So understand that. But understand the main thing is that this is patient choice. Okay, so compare that to hospice. There's lots of similarities. Hospice provides holistic care of dying patients that are not expected to improve. So the person has sat with their provider of care and they have determined that there's nothing else they can do to lengthen life. And so many times at that stage, then people do make decisions that are good for them, and they focus more on the quality of the life remaining versus extending life and not feeling well at all. And so again, no judgment zone, and many times the patient has come to this point but the family hasn't. But remember, as long as your person is alert and oriented, then we have to go by what choice they have made. So again, underneath hospice, provider and the patient has decided they have 6 months to live. The patient has elected that I want to be comfortable as opposed to just looking at extending my life. I want improved quality of the remainder of my life. So there are two premises that come along with hospice. One is that that quality of life is improved. Two is that that person is considered to be terminally ill. They have a choice to face death with dignity in the place of their choosing. So they may not want to die in a hospital. They might want to die at home in the comfort of their own bed, surrounded by their families or their pets. Good sheets, whatever is important to that person. And so we have to respect that. Inpatient hospice is always an option for patients to have, especially when families need respite. And so what do we mean by respite? Respite is when the families need a break from doing that day to day, because it is very challenging, first of all, to watch your loved one go through an illness that's going to result in death. And two, you can also get tired because you're trying to do so many things. It doesn't mean that you love your loved one any less. And so hospice is designed to help support families through that period of time. Sometimes a patient might need inpatient hospice to get them stabilized, because of course there's certainly some treatments and medications and things like that that have to be done underneath the 24-hour supervision of a healthcare facility, because it wouldn't be safe to do it at home. Care is planned with the patient, care is planned with the family, and so those decisions are made, and hospice is designed to support whatever those decisions are. And then after a person expires or dies, then hospice continues to supply support to that family. And that's one of the beauties of it, because the truth is this: grief is very individualized. You can't say somebody's going to get over something in 20 or 30 days or even 2 years. However, hospice is there to continue to support that family. Now, there's one other mode of care that we have to think about when we think about end of life, and this is something that is illegal in most states, so don't get caught up in doing it, and that's euthanasia. Euthanasia is the deliberate ending of life, and in most states it's against the law. So that could mean something like giving someone extra medication to hasten their death, withholding treatment that will hasten their death. So we're not in the business of doing things like that, and so don't get caught up with that. So if I were to ask you a question like, patient, you're taking care of a patient that has elected hospice, and that patient in month number 5 says, you know what, I think I'm getting better, I don't think I need hospice anymore. Does the patient have the right to do that? Absolutely, they have the right to do that. And sometimes healthcare medicine doesn't get it right. I mean, I personally know someone right now who was placed in hospice about 3 years ago, and she's still living. So don't think that it is like putting a nail in your coffin, because of course man is not the final say so on when this process is actually going to complete. But the takeaway for nursing students is that allow your patient an opportunity to make decisions. Make sure those decisions are informed. Make sure you're providing the support necessary for family members, such that they can deal with this. And understand that grief is very individualized. Also understand that your patient is not going to be the same every day, because can you only imagine, we all don't know when we're going to go, but to think that we have a disease that there's no cure for and that we might not wake up tomorrow morning, that's a little bit more daunting. And so sometimes you might see things like anger or displacement of emotions, and so be prepared for that. So that's the story between palliative care, hospice care, euthanasia, and so you should know the difference between the three. And of course they're very similar because they are dealing with times when a patient typically has a terminal illness. So bye for now. This is a nursing professor. Please like, subscribe, and I will see you next time.